everyone, my name is Minjung Cho. I'm one of the social media section editors of the Archives of Plastic Surgery. I'm excited to introduce APS Hot Off the Press. 2 times a month, we'll be hosting Hot Off the Press with one of the recently published APS authors and 2 panelists. You have a special opportunity to hear directly from the authors and join an insightful discussion between panelists. You can also leave your thoughts as a comment for further discussion.
Hello, everyone. Welcome to the APS Hot of the Press. I'm Kyori Kim, one of the social media section editors of the Archives of Plastic Surgery. Okay, so today's very first Hot of the Press, we have Dr. J.B. Hong, editor-in-chief of the APS, and Dr. Bomi Seong from the Catholic University of Korea, Ujeongbu St. Mary Hospital. First, let's hear our editor-in-chief, Dr. Hong's welcome message for you.
Thank you, Cody. And thank you for all the viewers out there in the world tuning in for the very first Archives of Plastic Surgery Hot Off the Press. This program, headed by Kyori Kim and Minjung Jo of US, is sure enough will bring you new insights and new knowledge in the latest publications of APS. Through this platform and through this program, I hope you enjoy the latest knowledge and also take that back home and incorporate into your practice. Remember, we are always available on social media to answer any questions that you may have that are not answered in this session. So without further ado, I would like to welcome you and also thank our section editors, Kyori and Minjung, for all their effort in starting this new endeavor. So thank you. Kyori?
Thank you so much, Dr. Hong. And also we have another panelist, Dr. Seong. Dr. Seong?
Yes, hi everyone all over the world. I am Bomi Florence and I work in hand and breast reconstruction at Catholic University's Ujeongbu St. Mary's Hospital. It is a great honor for me to be on this first session of Hot Off the Press by APS. Thank you very much for having me.
Thank you. Okay, let's get started. Today's article is titled Comparison of Breast Volume Change Between Oncoplastic Breast-Conserving Surgery with Radiation Therapy and a Simultaneous Contralateral Balancing Procedure through the Inverted T-scar Technique, which was published in 2020 November issue of the Archives of Plastic Surgery. It's an honor to have Dr. Hwan Bae with us today. He is also one of the authors of this article. Dr. Bae graduated Pusan National Medical School and trained in Pusan National University Hospital. Completing his fellowship, he is currently working as a professor at the Pusan National University Hospital and specialized in breast reconstruction. Dr. Bae, thank you for joining us today. Okay, I think you can start your presentation.
Thank you for introducing me, and it is a great honor to invite me and our study conducted in our school to be the first speaker of Hot Off the Press. Today, I will introduce an article titled A Comparison of Breast Volume Change Between Oncoplastic Breast-Conserving Surgery with Radiation Therapy and the Simultaneous Contralateral Balancing Procedure through the Inverted T-scar Technique in APS Volume 47 in 2020. I'm Seong Bae, Department of Plastic and Reconstructive Surgery of Pusan National University School of Medicine, the co-author of this paper. First, I will explain the background of this study. As early-stage breast cancer patients increased due to early diagnosis of breast cancer, breast-conserving surgery is also on the rise. BCS has advantages such as low complication rate, preservation of body image, better quality of life, and reduction of psychological morbidities. However, BCS has some limits in that it can create counter deformity and/or asymmetry in volume due to the decrease in the volume of the breast undergoing surgery. Oncoplastic surgery is used as a way to reduce contour deformity. With oncoplastic surgery, resection margin can be secured more safely, and the nipple areolar complex position can be corrected while obtaining a more natural breast shape. In large orthotic breasts, after BCS, oncoplastic surgery can be performed using the reduction mammoplasty technique. Therefore, if a patient with early stage breast cancer has a large orthotic breast, oncoplastic breast conserving surgery on the breast with cancer and reduction mammoplasty on the contralateral side can prevent contour deformity and volume imbalance. However, after BCS, in most cases, radiation therapy is administered to the entire breast. It is known that the volume may decrease after radiation therapy. As mentioned earlier, the balancing procedure on the contralateral side is performed to correct the volume imbalance. But how can we adjust the volume if the volume change can be caused by radiation therapy on the BCS side? So, if the contralateral balancing surgery is considered, it is common to perform surgery after sufficient time has passed after oncoplastic surgery and radiation therapy have ended. However, from the patient of view, it is preferable to perform both breast surgeries at the same time if possible. It is known that there is some risk of breast asymmetry when oncoplastic surgery and balancing surgery are performed simultaneously. On the other hand, in recent studies, even if both operations are performed simultaneously, it is reported that the results are sufficiently good. Then the question is, how much volume change can be expected due to the radiation therapy of breast that have undergone oncoplastic surgery? If you can predict the amount of volume change after radiation therapy, you will be able to more accurately match the final volume of the breast, even if you operate at the same time. So we can reduce the possibility of breast asymmetry from prediction of volume change. However, few studies have been conducted on this issue. Our research started from this point. For patients with early stage breast cancer, using the inverted T-scar technique, one of the reduction mammoplastic techniques, oncoplastic surgery on breast with cancer and simultaneous balance surgery on the contralateral side were performed. And then the degree of volume change was checked using CT images taken before and after radiation therapy. Here is the method of our study. From September 2012 to July 2017, out of 48 patients who underwent surgery by the aforementioned method, this study was conducted on 36 patients, excluding those who used lattice storage muscle, acellular dermal matrix, implant together, or who did not check CT. CT was performed once before radiation therapy, after termination of surgery and chemotherapy, and once at 12 and 18 months after radiation therapy. I will explain the surgical method. The day before surgery, while the patient was seated, the plastic surgeon performed the design using the inverted T-scar technique and marked the skin to be removed. On the day of surgery, the breast surgical oncologist performed the partial mastectomy by making an incision on the skin to be removed. After that, the plastic surgeon performed reconstruction with the concept of oncoplastic surgery using the remaining breast tissue. Then the contralateral side was simultaneously subjected to reduction mammoplasty or mastopexy using the inverted T-scar technique. Breast volume was measured based on CT image. When taking CT, the patient was laid in the spine position, the arm was abducted, and the lead wire was attached to the body surface to mark the breast boundary. From the obtained CT image, The volume of the virtual 3D area bounded by the following method was measured. In the cranial direction, 5 centimeters above the nipple, 5 centimeters below the nipple in the caudal direction. Ventral as the skin surface, dorsal as the entire surface of the pectoralis major muscle, the rib, and the intercostal muscle. Medial as the lateral edge of the sternum, and the lateral as the anterior of the lateral thoracic artery. In this way, the change was confirmed by measuring the volume before and after radiation therapy on both breasts that received oncoplastic surgery and contralateral balancing surgery. Let me tell you the result. The results were very simple and clear. Compared to the volume before radiation therapy, the volume after radiation was significantly decreased both on the PCS side and the contralateral side. On the other hand, the volume ratio of the PCS side to the contralateral side before radiation therapy was not significantly different compared to the ratio after radiation therapy. Here is the conclusions of our study. From the result of this study, the following conclusions can be drawn. As you can see, the volume of the breast that received radiation therapy decreased. However, the volume of the breast did not the volume of the breast that did not receive radiation therapy also decreased to a similar degree. These results suggest that radiation therapy may not be a significant cause of breast volume change. Therefore, if you plan a simultaneous contralateral balancing surgery with oncoplastic surgery after PCS, it is not necessary to make the breast on the PCS side larger than the contralateral side in consideration of the radiation therapy to be performed later. In addition, if the volume of both breasts is similar before radiation therapy, the volume of both breasts can be expected to be similar even after radiation therapy. This result will be helpful in establishing a surgical plan not only when simultaneous contralateral balancing breast surgery, but also when any kind of surgery that radiation therapy should be added is considered. In addition to this study, we have 2 other papers about volume changes associated with breast reconstruction. These 2 papers are also available on APS. Thank you for listening.
Thank you so much, Dr. Bae. I think the article is really interesting because there are so many other articles about like analyzing the volumetric change of the irradiated breast, right? But I think your article is kind of unique. What's the unique point of your article?
Yeah. There are several reports of a decrease in the volume of the reconstructive breast after radiation therapy. When comparing our study with other papers, the most important difference is that almost all of the papers have operated only one breast with breast cancer, and there was no case of measuring the ratio of volume of both breasts. In addition, many of the another papers reported that the volume was decreased clinically compared to the other side rather than measuring the actual volume. In our study, we also figured out that the volume on the irradiated side decreased. If only the volume of irradiated side was measured, I think that the result of our study would be similar to those of the previous papers. However, we measured both sides of the breast volume, and we got the results different from conventional idea.
Yeah. Dr. Saul, do you have any question or a thought?
I was actually very curious about how you would explain why the non-radiated side, the volume decreased on the non-radiated side. It seems that the mechanism would be a bit different for each side.
Well, it is difficult to explain exactly about that. And I think more research is needed to explain why this result came out. However, I think that during the wound healing process, like inflammation, proliferation, and maturation phase, fibrosis or decreasing edema would be the main cause of this volume change.
I see. Thank you.
So in the article, so it says, it's just said before the radiation. When did you actually get a CT scan? Like how long after the operation?
Yeah. All patients had the CT scans within 1 week of starting radiation therapy. I know that the CT scan at this time is essential to planning the radiation therapy.
I understand that your data shows that both breasts have decreased volume over time, but there must be a difference between the radiated side and the non-radiated side. So even though the overall volume of the radiated breast decreases, do you think that there is a difference in how each component of tissue is affected, fibrosis or other changes in each tissue?
Yes, we also experienced deformity cases due to the contracture that occurred after radiation therapy, especially in patients with the thin skin remained after partial mastectomy. Deformity seems to be occur frequently after radiation therapy. In these patients, it is possible that the volume decrease was greater than that of the contralateral side, but there are few cases. So I think additional research might be needed.
Yeah, I was curious about that too, because maybe the overall volume is same, but because of the skin envelope contracture, those kind of thing, breast shape can be changed after radiation therapy. I think Dr. Saul like thinking of that too, right?
Yes. Radiation is a very big challenge for me too. So I was wondering about that.
I agree too.
It's our enemy.
Yeah.
But it's also cancer's enemy. So
Right. Okay.
Yeah.
Okay. Do you have any personal tip to make a better result, like aesthetically better result, with the BCS breast?
Yeah. First of all, in the middle of the operation, when the patient seated on the bed, we check the shape of the breast several times after key suturing until the cosmetic result is sufficiently secured. If bulging or depression deformity is seen, additional breast tissue can be removed several times. If that does not improve the breast shape, contour deformity may be corrected by placing an acellular dermal matrix under the mastectomy flap. If the amount of partial excision is large and it is expected to be difficult to obtain a cosmetically good result, the operation plan may be changed to total mastectomy.
Yeah, I totally agree with you. Having the patient sit upright and checking a multiple time is kind of burdensome during the operation, but I think it's worth it because the breast is keep change its shape, right? Depending on the patient position, right? So I think there's a lot of like attempt to avoid this burdensome process, but I think it's not like a immutable step in any kinds of breast surgery. So making the better aesthetic result, so because of the umbilical contracture, sometimes the nipple position is changed, right? Do you have any tip for that too?
Yeah, if the shape is not satisfactory rather than the volume, we correct it using a local flap or a glandular flap. If the volume is severely insufficient, we consider two-stage breast reconstruction with expander after total mastectomy.
I have I was actually wondering how often you perform contralateral balancing surgery when after oncoplastic surgery. So, what are your indications for balancing surgery on the other breast?
Yeah, most patients with a large and taut breast are considered as candidates. However, if the patient has a wide breast, I think it is good to consider other surgical methods, even if the patient breast is large. This is because it is difficult to achieve aesthetically superior results with contralateral reduction or mastopexy.
The
So you
wide
mean
breast.
wider breasts?
Oh.
Yeah,
I think your answer shed on the light the fact that it's really hard to change the footprint of the breast, right?
yeah, you're right.
So actually, I asked to Dr. Seong. So in
Yes.
your practice, how do you do? Well, when you do the balancing procedure with the BCS breast, you purposely make it big, a little bit bigger, or just match it?
Well, this is very interesting because this is an issue that um, I was thinking about nowadays too. However, when I perform a balancing procedure for the contralateral breast after reconstruction for mastectomy, it's quite difficult to get the exact symmetric volume intraoperatively. Even though I set the patient up, I ask everyone in the OR, what do you think? Is it symmetric? I ask the nurses, I ask the residents. I'm actually working on a study on my practice to see what the factors are influencing the volume, intraoperative volume, and the volume afterwards. I feel like a lot of my patients have quite a bit of edema immediately after the operation. So during the operation, a lot of the tissue is swollen and has a bit more volume than it does post-operatively. So I'm working to find the my balance too. It was very interesting to hear your article. It was very helpful for me.
But I think this article. That's why I think this article is so interesting. So maybe it was myth. We think, oh, irradiated breast its volume will be decreased. Maybe it will. Finally, Dr. Bae and the other authors working on actual volumetric change of the breast.
Yes.
Yeah.
Yes.
Thank you so much.
Thank you so much.
How was the doing as the panelist, Dr. Seong?
Oh, this is so fun. I mean, I should.
Yes,
It
that
is
means
so.
I need to invite you again.
Oh no, this is very educational for me.
Yeah. That's
Speaking
good.
to the author in person is very helpful.
Right. And we're gonna share this with our audience, so it's gonna be good. Thank you so much, Dr. Bae. It's the first episode. Oh, you are the first guest for this one.
Great honor for me. Yeah, thank you.
Thank you so much. Okay, I think today we have a really productive time. Thank you so much again for Dr. Bae and Dr. Seong joining us today. And I'm really excited next episode of the Hot of the Press. Stay tuned, and we're gonna come back soon.
Bye.
Thank you.
Thank you.
Thank you everyone for joining us this fantastic discussion. Be sure to tune in for the other article that we'll be discussing on this month's Hot of the Press. You can also connect to Global Plastic Surgery Society through our YouTube channel, Facebook, Instagram, and Twitter. We're looking forward to meeting with you on our APS social media. See you soon.